Now that we've spent some time talking about pharmacology in terms of activity and affinity, let's spend a little bit of time talking about drug effect time. So what that really means is the effect that we see at different important points in time after administration of a drug. So the onset of action is the time that it takes for a drug to cause a therapeutic response. And this can be variable depending on the type of drug, the type of receptor, and how the drug is given. So a drug that's given orally oftentimes will take a little bit more time to work versus a drug that's given intravenously because it needs to be absorbed. We also can see a number of drugs that take some time before we actually see a therapeutic response because the response itself isn't due to the receptor interaction, but due to downstream effects that occur in response to that receptor interaction. So a serotonin reuptake inhibitor, for example, will block the reuptake of serotonin pretty much right away. However, the mood improvement that we tend to see, it oftentimes takes a number of weeks before we see that therapeutic response. The peak is the time necessary for a drug to reach the maximum therapeutic response, and this again can be variable depending on the drug, the site, and how it's given. However, a drug like an antihypertensive or a blood pressure lowering agent, for example, if a peak response occurs within the same day, that's really when we'll see the most blood pressure lowering. Duration of action is the time that a drug concentration is enough in the body that it'll cause a therapeutic response. So oftentimes there has to be some sort of ceiling in which the drug has to be available in the body, so a certain level of concentration for it to work. And the amount of time that it spends above that concentration is loosely correlated with how long it's working to do its job. And this is a basic overview of how time affects pharmacology. Doesn't apply to every single drug, but it's important to consider. We also want to think about the specificity and selectivity of the drugs, particularly when we're thinking about interactions with receptors. So drugs can be selective or non-selective. And really what that means is if a drug is selective, it's able to affect a particular receptor preferentially. So if we think about things like serotonin receptors, there's a lot of different serotonin receptors in our body. And some drugs are much more selective for particular subtypes versus others. However, if you give more and more of a drug, it's less and less likely to become or to be selective. So it can become overloaded and sort of spill over, if you will, into other receptor types. The specificity kind of refers to the effect of the drug. So if something is very, very specific to a singular effect, it doesn't matter how much of the drug you give, it really won't overcome that singular effect. And not a lot of drugs are particularly specific in that sense, but it's important to think about how selective and how specific drugs are when we're giving them, because that oftentimes determines adverse effect profiles. We also want to think about the therapeutic index of a drug. So if you give more and more of a drug, that's not always a better thing, right? So what a therapeutic index does is it actually looks at the ratio of the amount of drug that produces toxicity compared with the amount of drug that produces an effect. So most drugs have what we consider a wide therapeutic index. That is, the amount of drug to work is significantly lower than the amount of drug required for it to be toxic or dangerous for a patient, or at least from an overdose perspective. A smaller therapeutic index really means that the drug is a higher risk medication because it's a lot easier to go from therapeutic to toxic versus a wide therapeutic index drug. A common drug that we use in psychiatry that is a narrow therapeutic index drug is lithium. So the amount of lithium we need to produce a therapeutic effect is not that much less than the amount of lithium that can be toxic to people. So we have to do a lot of therapeutic monitoring of that drug to make sure it's still within a safe range within the body.